This is my first system of my entire pulse system. This is the first group. We call 6 pulse. 大小 Huan dispersing Ji. Maybe you should learn some Chinese anyhow. Hua, Se and Hua. Actually, these 6 pulses originally came from the Huangdi Neijing. They used to make diagnosis from the skin of their forearm, the elbow or something, to feel there's something wrong with the body. But I borrow those terms for all the internal medicines. And this pulses can be independent or not. For example, originally, 大脉 means the expanding, means everywhere. That means the time, actually it means the time before the man has a stroke. Actually it's before that. And 小脉 just describe the patient is just generally weak. That's it. And actually, this 6 pulse was used to combine with acupuncture treatment. Like 大脉, the treatment should be releasing the blood. And 小脉, the Huangdi Neijing was telling us that we do not use acupuncture for anybody with a 小脉because he's already weak enough. The acupuncture will only cause his body to give more energy, to lose more energy. Even the symptoms will improve after your treatment with the needles, but basically you're damaging his body more. So 小脉 do not use needles. And 缓脉 use some needles combined with the 五腧六俞. Is that so? 五腧穴. So combined with 五腧穴, and then the 急脉 like use some kind of points. But I use them for internal medicine with herbs, combined with herbs. And I use them independently or dependently. Because 大脉 can be the whole condition, because this guy is suffering, is going to have a stroke. It's a very urgent, critical condition. All his pulse will be 大. His weak might be all 小 or 缓急. But actually, in daily treatment, we don't have those kind of critical condition all the time. We have different problems. We use this pulse to different positions. For example, this guy is suffering from a very severe bronchitis or something. He will have 大脉 on the right cun only. The rest of it can be something else. Or if this guy is suffering from acute gastritis or gastro ulcer or food poisoning, the 大脉 will be there. This is general description. It can be anywhere. So we combine the pulse with the positions, then we get a clear idea of the what condition. Maybe, for example, this guy is suffering from gastritis, but he's also weak. He also have a back pain. He also had a cold, but he doesn't mind that. He just wants you. His major concern for the treatment, for the visit to your office, is to take care of his stomach problem. So we just focus on the stomach, on the see how the condition is. So the 大脉 we would do something, 小脉 would do something, 缓脉 do something. This is a general idea. Then afterwards, I'll be explaining how to take the pulse and how the pulse will feel. Okay. 大 means big. The 大 means big pulse. Big pulse is like something about to explode. I always describe it, hey, your body is like a volcano. It's about to blast off. So mostly the jump is strong. When the jump is strong and fast, and it gotta be superficial, strong. But 大脉 can happen to people with high blood pressure, with no high blood pressure. If it has high blood pressure, it will be strong and hardened. So you can easily verify by taking the blood pressure. That's it. But let's pretend he's not taking any medication. If he's taking blood medication like a blocker or beta blocker or calcium or diuretic stuff, that will be something else. Okay, we'll be talking about the original condition. The big pulse is jump and fast and thick and hard. Everything. I use just one word, expanding, or you can tell it's volcano. Most of the time, it can be anywhere. Depends on the condition. And this is very strange. The big pulse, well, theoretically, we think this is supposed to be happening on a young, strong guy, right? But actually, this pulse happens a lot on the elderly people with 80 years old, 85 years old, they have such a big fire. I always wonder why they have a big fire. You're so old, you're not supposed to have the volcano in your body. And also, you can verify his fire by verifying his ear points or something. You can see a lot of redness there. The ear can show you exactly what condition it might be. Strong, thick, and fast. Might not be fast, but it's definitely expanding. I'm sure you understand the word when you feel, when you touch it. So next time, that's not difficult to get this. Next time, with the patient with the blood pressure, maybe not over the normal range, not only 138 over 90 or 140 over 85 or something, but combined with a fast heartbeat rate like 85 or 90 or something, put them all together, we can talk. We can certainly say that's solid heat. Actually, this 6 pulses, the 6 pulse usually designed to make the 8 differential 8 principal diagnoses. Surface, inside, too much, less, not enough, yin and yang, all of the stuff. And those pulses are supposed to give you an idea of what condition may be. So don't listen to their complaints too much. Don't be misled by their sayings. Because a guy with a big pulse, with all the fire in his body, the major complaint can be fatigue. Hey doctor, I'm so tired, give me something. I'm always so weak, I feel like sleeping all the time. Actually, his body condition is opposite. It's full of heat, like a volcano. You give something like to tonify his energy, you'll be in trouble, big trouble. So the pulse will tell you the truth, their words might not. The pulse appear to be, okay. Oh, this one? Okay. Back example how expanding pulse is the brachial pulse. Okay. Here is the position. Come on, give me a hand. Usually I do this. Yeah, I can take. Usually I take left hand, so but whatever. So here, take the pulse, and I always do this. Here, in this area, you can see clearly through the computer than in classroom, right? Zoom. Here, you feel it. There's because the artery here from the heart directly here and divided into 2 branches from here. So this one is definitely thicker than this 2. So this is normal pulse. If the pulse feels like here, this is just an example model for you to test. If you feel like big, can you feel it? Of course, you can't miss it. It's big and thick expanding condition right under here. This can be the model of big pulse. Okay? Thick means excessive fire. That's so easy. So, it can be anywhere. Can be even the big pulse can happen anywhere. Sometimes in the chi area. Sometimes means the hormone imbalance or something. If it happens on the liver area, definitely liver fire or something. So no matter where it happens, that means excessive fire. There's got to be some problem there. And after you find the pulse, that's time you verify it by asking your patient. Hey, you have problem here, there, somewhere. You must have symptoms. If they refuse to admit that they have symptoms, you just write it down. I encounter this all the time. So I write down, there's no symptoms. I make a mark. You can make your own mark, whatever. No symptoms. And they will come back to you for this, all the problem. Because if the pulse appears, definitely something wrong in their body. Big pulse, even though in the original design for this treatment for this big pulse is for releasing blood, but we don't do it very often in the office. We use something heat clearing stuff to eliminate the fire by using this is the principal treatment for this. Of course, we use cold medicine. That's very natural thoughts. But actually, we should use something salty and something accurate for this big pulse to clear away the fire. That's the principle. Like something sour is something salty. We have developed something for this a lot in the combination herbs. So if the damai happens anywhere, we can simply say it's fire, or you can say inflammation and in expanding condition. Definitely the patient will have symptoms. They couldn't miss it. A lot of symptoms might appear under the damai. So the damai is big. So like I said, next time, tomorrow, maybe in the morning, a patient comes in with the high blood pressure, with the fast heartbeat rate, the pulse will be big all over, because that's a general condition. If he's just suffering from the stomach pain or something, there could be a big pulse on the right side. But if the patient already tells you that, hey, I've been diagnosed as a gastro ulcer with H. pylori infection or whatever in the stomach is expanding, acid reflux or something, but the pulse doesn't show that, there's something tricky going on down there. You have to be very careful. The pulse should match the symptoms. If it doesn't, there's something more serious. We'll talk about later. Just for the, generally speaking, naturally, big pulse means fire and expansion, expanding condition with inflammation or something. Okay? Yeah, deficient patient will not have expanding pulse, only in a critical, very strange condition. 这什么东西? Oh yeah, on a Qigong practitioner may not demonstrate of abnormality. Yes, that's true. Who wrote this? You. I did. Well, I'll say you did. I'm going to say you're very clever. So big pulse can happen, the summary. Any questions? So big pulse can happen on both positions for people with high blood pressure with a dangerous condition. And the big pulse can happen in individual positions for the local problems. Might not be blood pressure related, just some inflammation of the certain related organs. Huh? Oh, okay. Okay, next